Welcome students, myself Akshaya. Today we are going to see about anti-ulcer drugs. Anti-ulcer drugs are the drugs which are used to cure ulcer. First major cause of ulcers are peptic ulcer. Introduction. Peptic ulcers form when cells on the surface of the lining become inflamed and die. Peptic ulcers are also the source that develop on the lining of stomach, lower esophagus and small intestine. They are formed as a result of inflammation caused by H. pylori as well as eruption from the stomach acid, which means hydrochloric acid. Anti-ulcer drugs are the drugs used to treat or prevent ulcer of intestine or stomach. These drugs act either by inhibiting acid production or by killing the microorganisms responsible for ulcer. Physiology. Etiology. H. pylori. Drugs such as non-steroidal anti-inflammatory drugs, lifestyle factors, severe emotional or physical stress, having family history. Classification of anti-ulcer agents. Reduction of gastric acid secretion. H2 antihistamine, cimetidine, ranitidine, famotidine, roxatidine. The proton pump inhibitors, omeprazole, lansoprazole, pantoprazole, rabeprazole, and esomeprazole. Anticholinergics. Principin, propantheline, oxphenonium. Prostaglandin analogs, misoprostol. Neutralization of gastric acid and acids. First one, systematic. Sodium bicarbonate, sodium citrate. Non-systematic. Magnesium hydroxide, magnesium trisilicate, aluminum hydroxide gel, calcium. Ulcer protectives. CBS. Colloidal bismuth subcitrate. Fourth one, anti-H. pyloric drugs. Amoxicillin, clarithromycin, metronidazole, tinidazole, tetracycline. The drugs used in peptic ulcer. First, antacids, which neutralize the acid in the stomach and thus prevents the ulcer formation. First, it reduces the gastric acid secretion. The H2 receptor blockers, cimetidine, ranitidine, famotidine, and roxatidine, its mechanism of action is they inhibit the acid secretion by blocking H2 receptors and the peroxide. These agents inhibit gastric acid secretion by competitively blocking the binding of histamine to H2 receptors, decrease the gastric acid secretion. They are only taken orally and thus absorbed in the gastrointestinal tract. They undergo first metabolism in liver and its overall bioavailability is 50%. Its use is in peptic ulcer, Solinger-Ellison syndrome and GERD. Adverse effects: diarrhea, dizziness, muscle pain, hypotension and gynecomastia. Second one, proton pump inhibitor. Proton pump inhibitors examples are omeprazole, rabeprazole, pantoprazole, etc. Its mechanism of action is it acts by reversibly blocking the hydrogen and potassium adenosine triphosphate enzymes system of gastric peroxide. It is used in peptic ulcer, GERD, Solinger-Ellison syndrome. Adverse effect: nausea, abdominal pain, constipation, subacute myopathy, headaches, and skin rashes. Anticholinergics. It inhibits the acetylcholine action of muscarinic receptor, decreases HCl secretion, and have low efficacy and anticholinergic side effects. Next one, prostaglandins analog, misoprostol. It increases the music and bicarbonate secretion, increase blood supply, decreases HCl secretion, etc. Contraindications. It is contraindicated during pregnancy because it is can increase the uterine contracting. Adverse effect: diarrhea, nausea are the most common adverse effect. Neutralization of gastric acid. Systematic bicarbonate and sodium citrate. Non-systematic aluminum hydroxide and magnesium hydroxide. Its mechanism of action: antacids are weak acids and react with the gastric acid to form water and salt, thereby diminishing the gastric acid. They reduce the gastric acidity and increase gastric mucosal protection. A single dose of antacid can neutralize an acid for 2 hours. Sodium bicarbonate, effective, rapid action onset by short acting, and it has some disadvantages used in acidosis. Magnesium hydroxide and aluminum hydroxide, They react slowly with the HCl and they are combined together because aluminum causes constipation and magnesium causes osmic diarrhea. They can interact with the drugs inhibiting their adverse effects, drug interaction. Ulcer protective. Its mechanism of action is these compounds known as cytoprotective compounds have several actions that enhance mucosal protection mechanism, thereby preventing mucosal injury, reducing inflammation, and healing existing ulcer. Adverse effects: constipation, dryness of mouth, and abdominal discomfort. Anti-H. pylori drugs. Mechanism of action is the antimicrobial agents act on the bacterial cell wall synthesis and bacterial protein synthesis. Resistance to metronidazole occur rapidly but not in amoxicillin. Adverse effects: epigastric pain and hypersensitivity reaction. Thank you.